Hey guys, welcome back to our channel. This is Dr. Dwain Woode from Diabetes and Endocrine Wellness Center and the Lighter Way in Huntsville, Alabama. Today we're going to talk a little bit about the updates that the CDC has put out in how to behave, how to get together for people who are fully vaccinated. Let's go ahead, let's get started. Well, welcome back. Welcome back. We are constantly hearing about COVID. It's in the news. The pandemic is still in full swing. But one of the positives that we are excited about is that we are having more and more people who are vaccinated. And so the CDC has recently put out a new set of guidelines on how people who are vaccinated can behave, can function. And so I want to spend some time today just kind of going through that with you. I've got the CDC website up, so I'm going to just kind of go through. First of all, is defining what does it mean to be fully vaccinated? What does it mean to be fully vaccinated? And according to the CDC website, you can look this up, cdc.gov, under the COVID page, is anyone who has received 2 doses, either of the Moderna vaccination or the Pfizer. 2 weeks after your second dose, you are considered to be fully vaccinated. Anyone who has received the Johnson & Johnson vaccine 2 weeks after that vaccine, and you know that's just 1 dose, then you're considered to be fully vaccinated. One caveat there is to remember that there may be some conditions that causes a person to be immunocompromised. And so they, even though they received either 2 doses of the Moderna or the Pfizer, or the 1 dose of the Johnson & Johnson, they may still not be considered to be fully vaccinated. So please check with your healthcare provider, okay? Now, if you've been fully vaccinated, what are some of the things that you can do, right? Number 1, you can gather indoors with fully vaccinated people without wearing a mask or staying 6 feet apart. Now, that is huge, right? Because we've been doing the social distancing. And so now the CDC is saying if you are fully vaccinated, as we described earlier, you can now gather indoors without a mask, and you do not have to maintain the 6 feet distance. If you are fully vaccinated, you can gather with people from one other household of any age without a mask and without socially distancing, unless someone in that household is at risk for severe disease or COVID-19. The next part of the guideline is that you can gather outdoors. Once again, if you are fully vaccinated, you can gather outdoors without a mask, and except at certain particular venues, and those venues are listed at the CDC website. So this next one has to do with traveling. If you are traveling inside the United States and are fully vaccinated, you no longer have to be tested prior to traveling or after traveling, and you no longer have to self-quarantine. Now, that's a huge one because it opens up for a lot of people the ability to travel within the United States without worrying about having to quarantine. This next part is specific to international travel. First, you need to know that you do not need to get tested prior to traveling internationally unless the destination country requires testing. If you are boarding an international flight back into the United States, you do have to have a negative COVID test or prove that you are recovering from the COVID-19, and this is before you get on that plane coming back into the United States. Once you arrive in the United States, You should be tested 3 to 5 days after arriving, but you do not need to self quarantine after arriving in the US. And finally, if you are around someone who is positive for COVID 19, you do not have to get tested or stay away from other people unless you have symptoms. This is unless you live in a group setting where there are multiple people. You should still at this point get tested and stay away from others even if you don't have symptoms. So those are the things that the CDC has said that people who are fully vaccinated can now do. Now, what are some of the things that you should continue doing? One, you should continue protecting yourself, right? So if your employer, if a facility requires you to wear a mask and socially distance, you should follow those guidelines. You should still continue to sanitize, right? Using hand sanitizer where appropriate. You should still continue to monitor yourself for symptoms of COVID 19, and you should still avoid large indoor gatherings. Remember, we want to make sure that we are staying safe, that we are protecting others, and that we are following the guidelines that have been given by the Centers for Disease Control. You can find more information and you can monitor updates by going to cdc.gov. We'll put the link in the description below. We are excited about growing this community. If you've not already done so, go ahead and hit the subscribe button. Hit the bell so that you get notified when we do additional videos. Also, share and like this video. We're trying to create a community, a place where we can be educated, a place where you can come to get answers for some of your medical questions. We want to grow this community, and we're trying to do so by growing our subscribers to 1,000 by the end of the year. That's right. You heard me. December 31st of 2021, we want to have 1,000 subscribers. Why don't you help us on this journey? Come join us, learn with us, comment, like what you see, and send us suggestions on what you want us to cover. Thanks for joining us today. Thank you for watching. This is Dr. Dwain Woode from Diabetes and Endocrine Wellness Center and The Light Away, educating the public for a better you.